Good morning. Today we are going to discuss about the female pelvis. Let's start. First, let's discuss about the bones of the pelvis. So, there are 5 bones. Out of 5 bones, 3 are innominate bones, that is hip bones, that is ilium, ischium, pubis. Ilium, ischium, pubis. These are innominate bones. Next 2 bones are sacrum and coccyx. This tailbone is known as coccyx. So let's start with the ilium. This is iliac crest. This is iliac fossa. This is iliac tuberosity. So this is iliac crest. This is iliac fossa. This is iliac tuberosity. The next parts of ilium are, this is anterior part and this is posterior part, as you all know. This is superior, this is inferior. So this will be anterior superior iliac spine and this will be anterior inferior iliac spine. The back side, this will be the posterior superior iliac spine. This will be posterior inferior iliac spine. So these are the parts of the ilium. Next we are going to discuss about the ischium. So the first part we are going to discuss is acetabulum. This is the part where our femur bone, the longest bone in our body, femur bone gets attached, femur bone. So this is acetabulum. This is obturator foramen. Note it down. This is obturator foramen. And this is ischial tuberosity. This round part, dome part is known as ischial tuberosity. So here we have discussed about the iliac spine. This is ischium. The spine which comes in ischium will be ischial spine. Next we are going to discuss about the pubic bone. In pubic bone we will see about the superior ramus and inferior ramus. Superior ramus and inferior ramus. So this is ilium, this is ischium and this is pubic. In pubic we will see about the superior ramus and the inferior ramus. In ischium we have seen about the acetabulum, obturator foramen, ischial tuberosity and the ischial spine. And in ilium we have seen the iliac crest, iliac fossa, iliac tuberosity, anterior superior iliac spine, anterior inferior iliac spine and all. So the next part we are going to discuss is sacrum. This is sacral promontory. These 2 wings in the sides of sacral promontory are known as sacral ala or ala of sacrum. Clear? So here we have discussed this as obturator foramen. In any hole you see in female pelvis is foramen. So the holes here you have seen, these holes are known as foramens. Clear? So in sacrum we have discussed about the sacral promontory, 2 wings, that is sacral ala. This is foramen and this tailbone, as I have told first, this is coccyx. This bone have a speciality. You keep in mind that this bone is the bone which goes backward during delivery time. This will go backward during delivery time and will cause back pain to the mothers. Gradually it will come back. Next we are going to discuss about the joints. So give the heading joints. So this is sacrum, this is ilium. The joint joining sacrum and the ilium is called sacroiliac joint. Clear? Sacrum ilium joint, sacroiliac joint. The joint joining sacrum and coccyx, sacrococcygeal joint. Sacrum coccyx joint, sacrococcygeal joint. The joint joining 2 pubic bone, symphysis pubis. The joint joining 2 pubic bone, symphysis pubis. Next we are going to discuss about the ligaments. Now let's move on to the ligaments of the female pelvis. So first ligament is sacroiliac. Sacroiliac ligament. The second ligament is sacrococcygeal, that is sacrum to the coccygeal. This is sacrococcygeal ligament. You can see sacrococcygeal ligament. So sacroiliac, sacrococcygeal. The next one is sacrum to the ischial spine, sacrospinous. It will come like this, sacrospinous. Next is from sacrum to the ischial tuberosity. It will come like this, sacrotuberous. The next one is between two pubic bone, interpubic ligament. Interpubic ligament between two pubic bone. So there are 8 landmarks starting from the sacral promontory, sacral ala, sacroiliac joint. This is iliopectineal line. This is iliopectineal eminence, superior ramus. Next is upper inner border of pubic bone. Next is upper inner border of symphysis pubis. So these are the landmarks. So we have discussed about the bones, joints, ligaments, landmarks. So we are going to discuss about the conjugate. So there are 3 conjugates, that is obstetric conjugate, diagonal conjugate and anatomical conjugate. First we will discuss about the anatomical conjugate. It is the distance between the midpoint of the sacral promontory, that is sacral promontory, as we know this is sacral promontory, from the midpoint of the sacral promontory to the inner margin of the upper border of symphysis pubis. As we know this is symphysis pubis, the sacral promontory, from the midpoint of the sacral promontory to the upper part of the symphysis pubis. This is anatomical conjugate. This is 11 centimeter. Next we are going to discuss is obstetric conjugate. The obstetric conjugate is the distance between the midpoint of the sacral promontory to the midline of the symphysis pubis. That is 1.5 centimeter down of the anatomical conjugate will be the obstetric conjugate. That is like this. This will be 10 centimeter. Next is diagonal conjugate. That is from the midpoint of the sacral promontory to the lower part of the symphysis pubis. Like this it will come. It is 12 centimeter. The pelvis is divided into 2, that is false pelvis and true pelvis. The false pelvis is also known as greater pelvis. It is formed by iliac portions of the innominate bone. That is, this is the innominate bone. As we know, this is ilium, ischium, pubic. So these are the innominate bones, and it will be formed by this all bones. So the false pelvis is this. The whole part of the innominate bones will be false pelvis, the greater pelvis. The obstetric function is to support enlarged uterus during pregnancy. So the next is true pelvis. It is also known as lesser pelvis. It forms the canal through which the fetus has to pass. So the inside part is true pelvis. Clear? The inside part, this inner canal, this is true pelvis, and all of this is false pelvis. This true pelvis is divided into inlet, cavity and outlet. So we will see this inlet, cavity, outlet, all these in diameters of the female pelvis. Let's go on to it. So let's know about which is the inlet, what is cavity and what is outlet. So nothing much. The baby goes in, inlet. The baby goes out, outlet. In between inlet and outlet, what is there? Cavity. So this is inlet, this is cavity and this is outlet. So there are 3 types of diameters: anterior, posterior, oblique, transverse. Anterior posterior diameter, as you can see in the video, it's from the sacral promontory to the symphysis pubis. Anterior posterior diameter is from the sacral promontory to symphysis pubis. The oblique diameter is from the sacroiliac joint to the iliopectineal eminence. This will be the oblique diameter. So next is the transverse diameter, that is between two iliopectineal lines. Between two iliopectineal lines is the transverse diameter. So is an easy technique for studying the female pelvis diameter, that is inlet, cavity, outlet. Anterior posterior diameter, oblique diameter and transverse diameter. So the inlet diameters of anterior posterior oblique transverse are, the cavity diameters are, the outlet diameters are 11, 12, 13. In cavity all the diameters are 12 centimeters. In outlet it's the ulta of inlet, that is 13, 12, 11. In inlet 11, 12, 13. Nothing is there, it's easy to study. So if the question comes, what is the transverse diameter of inlet? What is the transverse diameter of inlet? 13. What is the anterior posterior diameter of outlet? Anterior posterior diameter of outlet 13. Here if you are noticing, you can see all the cavity diameters are 12 and all the oblique diameters are 12. So in the question if it comes, what is the oblique diameter of outlet, inlet, cavity? What's the answer? 12. And also, what's the anterior posterior diameter of cavity? What's the anterior posterior or oblique diameter of cavity? What's the transverse diameter of cavity? If the word cavity or oblique comes in the question, what's the answer? It's 12. So you should notice only this anterior posterior and transverse. That is inlet is 11, 13. Ulta it will come in the outlets. That's all. So that's all about the female pelvis. I think now you got a clear picture. What is female pelvis? What are the bones, joints, ligaments, landmarks, conjugates and diameters. So thank you.